The number of Americans who are dying from heart issues continues to rise, and it just so happens to have all started during the first year of the health crisis. The problem is that it's now becoming more common in patients under the age of 40 years old, which is extremely young. The question is, how are these two events related? A doctor has now cleared the air about this, and you're not going to believe the causes that she enumerates. Also, have you heard about what's happening over in Brazil? It's really something else. Their president has just said that their government-funded social welfare initiatives will only be provided for the poor who agree to be vaccinated. Now, we all have different opinions about the jab, and that's the beauty of having the freedom to choose what we want to do with our bodies. But do you agree that forcing people to get jabbed for government benefits is the way to convince them to get vaccinated? Just drop a quick comment yes or no down below for that one. Now, I've noticed that many of my videos, if not most of them, have been getting censored here. And I remember someone asking how they can help spread the message. Well, the easiest way to do that is to drop a like for the video, and another would be to share the video to everyone that you know. And lastly, of course, subscribing to the channel so that you can receive your daily dose of the truth. All right, guys, appreciate the support. Let's go ahead and get the show on the road. So what are your thoughts on vaccines? And I'm not talking about the C-19 vaccine. I mean, like, vaccines in general. Like, what comes to mind when you hear that word? Now, for some, it's something that helps us fight many different diseases. I mean, there's a lot of you that probably get a flu shot every year. For others, it somehow feels like a nuisance, something that can be done away with. No matter how you look at it, each person has a right to cite their opinion without stepping all over the other person's decisions to either get or reject a jab altogether, which is why I'm confused as to what's happening over in Brazil. Their president, Luiz da Silva, just announced recently that parents are going to have to provide proof of vaccination if they plan on receiving benefits from the Bolsa Family program. What is this program? Well, it's a social welfare initiative that is targeted at helping the poor households in the nation. But here's the really controversial part of this ruling. It's not the parents that need to provide their vaccination status, but it's their children that need to get jabbed in order for them to get anything from the government. Now, according to Lula, quote, the Bolsa family is coming back, and it is coming back with something important. It is coming back with conditions. The children have to be in school. If they are not in school, the mother loses that benefit. The children have to be vaccinated. Suppose they don't have a vaccination certificate. In that case, the mother will lose the benefit, end quote. Their president also said that this isn't the time to think twice about clinical trials or anything of that nature, and that they shouldn't be ignorant. It also doesn't matter how many shots kids are supposed to take. They just need to take them. You want to know how serious they are about this? They even have a mascot to convince people to take the vaccine. Granted, they've had this character since the 80s. He kind of looks like Casper the Ghost, but with a huge sign that says SUS on the body. Lula adds, quote, now the Zigathana campaign will begin. We can't hesitate. We can't play around. It is a question of science. If there are 10 C-19 vaccines, 50 to take, I will take as many as necessary because I like my life. I think everyone has a duty to their children's life. Take them to vaccinate at the right age, end quote. I want to defer this to you guys. Now, when it comes to C-19 vaccines, because we did talk about this together with other shots like measles and the like, but when it comes to the ones that just came out during the health crisis, would you guys be comfortable if the government mandated 50 booster shots for your kids? And if we didn't agree to it, would it be fair that they cut our Social Security, SNAP, or EBT benefits? Also, the big question on a lot of people's mind is that we were told by the World Health Organization themselves that healthy children and adolescents don't need boosters. So why mandate it? At the end of the day, it should be a choice. It's confusing to think that a president would hold back government benefits just because of a vaccine. But what do you guys think about that? Is there some motive there? Another phenomenon, if you can call it that has been happening throughout our country is the rising number of people who are having heart issues. What's worrying is that data is showing that age isn't that much of a factor. And even those who may not be at an age that commonly suffers from heart attack, they're just dying from them. Imagine being younger than 40 years old. This is close to our prime years when most of us lead an active lifestyle, or at least is capable of leading such a life. But ever since the first year of the C-19 pandemic, a spike in cardiovascular deaths occurred in our country, many of them age 40 years old and below. So what do you think happened to these people? Well, listen to Dr. Celine Gounder as she clarifies what may be happening behind the scenes. Take note that this was around 3 minutes, but I swear it is worth your time.
Heart attack deaths have become more common across all age groups since the start of the coronavirus pandemic.
But a recent study found that young people are actually most at risk in this case. According to Cedars-Sinai Hospital, the number of heart attack deaths among 25 to 44-year-olds in the U.S. over the first 2 years of the pandemic was 30% higher than predicted. Dr. Celine Gounder is here on set with us to talk more about it. She's editor-at-large for public health at Kaiser Health News, and she is also an infectious disease specialist and epidemiologist. And a CBS News medical contributor. Dr. Gander, thank you for being here. What stood out to you in this study?
I think the fact that you're seeing such a big increase specifically in the youngest age group, so the 25 to 44-year-olds, you saw this 30% increase in the risk of death from heart attack. And that really is quite striking. That's not a group, an age group in which you normally see heart attacks, much less dying from a heart attack.
So to do a study like this, you look at the years prior to the pandemic and the typical rate of heart attack death in that age group, and then you see it increase and you wonder what's the new variable. And so the pandemic is that new variable?
That's right. So these researchers looked at 10 years of data across the U.S., all the death certificates that get filed with the CDC, that data. And so what they saw is prior to the pandemic, heart attack deaths were actually dropping. And then that trend reverses, and you see those deaths go up, especially among that youngest age group during the pandemic.
And do we know why why younger people might be more at risk, or?
We don't know for sure. And in fact, these death certificates are probably not even capturing the fact that they might have had COVID. They're really just saying, did you die from a heart attack or not? What we do know, however, is that younger people were less likely to protect themselves against COVID than older people, less likely to mask, less likely to take other mitigation measures. And they were also farther back in line to get vaccinated. So they were not protected with vaccination until later in the pandemic. Those might have been a factor here.
So basically, I mean, you could have had perhaps a mild infection, and of course, this is all hypothetical, but then there might have been a lingering heart situation, heart disease.
Right. So COVID causes inflammation of the blood vessels as well as other parts of the body, and also blood clots. And what we think is that a COVID infection may have actually accelerated the process of developing heart disease, what we call coronary artery disease, and so therefore accelerated when somebody might have had a heart attack and died from a heart attack.
You know, but COVID also changes how much you can get out to an exercise class, how often you see friends, maybe your level of activity overall, your stress, whether you see your doctor. I mean, how are they ruling out or accounting for these other lifestyle changes?
We don't know. So you can't really assess that just from looking at death certificates. Again, all we can say is how old were they? Did they die from a heart attack? But, you know, some of the factors you're mentioning could certainly have played a role. We also know healthcare facilities were really overwhelmed during the pandemic. So was it that somebody had a heart attack and then was less likely to survive because the healthcare facility was overwhelmed?
Couldn't get there on time.
Okay, I'm not even going to say much, but I do find it odd that they're blaming everything under the sun besides something that may have been introduced to people as well during this time period. You know, something that may not have been tested properly. But what do you guys make of all this? While we can't be certain as to what's happening with the younger generation, I mean, you know, even the doctor basically said that she had no idea as to the exact reason of why this was happening. We are certain that life has gotten much harder in the past few years. It continues to be difficult, especially with the cost of living as it is now. Now, off the top of your head, how much are eggs at your local Walmart or Target right now? And as food prices, gas, rent, and debt payments continue to become heavier, it's tough to say that we're now being overwhelmed. But that should not be the case for everyone, especially not for those who are in this amazing community. Now, I have a link in the video description down below to join our Patreon community where we talk about stock market, real estate, starting small businesses, side hustles, budgeting. The road to financial freedom is not easy, but it's also not impossible. Now, before I go, don't forget to drop a thumbs up for the video. Also subscribe for your daily dose of the truth. I appreciate you guys watching. You guys are awesome. Please be kind to one another, and I'll see you in the next one.